All right, today we're diving into a medical case that honestly reads more like a detective story. We're talking about a deadly disease that just refused to play by the rules, all centered on what's known as an atypical presentation of toxic shock syndrome. You know, every doctor dreads the great impersonators, illnesses that mask themselves as something common. And this case, it starts with what everyone thought was just a simple infection. But as you'll see, it was hiding a catastrophic crisis right beneath the surface. So let's get right into it. The story begins in a place we're all familiar with, the emergency room. And it starts with a patient whose symptoms, well, they seemed frustratingly and, as it turns out, dangerously familiar. Okay, picture this. A 21-year-old guy walks in. He's got a fever, a nagging dry cough, and he's short of breath. They do a chest x-ray and, yep, it shows some cloudiness. Now, if you're the doctor, what are you thinking? This screams a classic case of pneumonia, right? Or maybe a really bad flu. At first, everything seems to be going completely by the book. So the team starts digging into his history. He's a healthy 21-year-old, no smoking, no drinking, no drugs, no real red flags at all. The only thing that really stands out is this minor procedure he had 9 days before. It was to drain something called a piloneedle abscess, which is just a pretty common type of skin infection. But here's the kicker. The surgical site? It looked totally fine. It was healing well with no signs of infection whatsoever. So it's a detail they noted down, but at first, it really didn't seem like the source of all this trouble. And then, this is where the case takes a sharp and frankly terrifying turn. The patient's body just starts sending out these massive, system-wide distress signals. And his decline? It was unbelievably fast. First up, that fever. It's sitting at 102.4 degrees Fahrenheit. That's not just a fever. That's a clear sign the body is fighting a huge battle. Then you look at his heart rate. We're talking 124 beats per minute while he's resting. That is dangerously high. His heart was just working in complete overtime, desperately trying to pump blood to organs that were already starting to struggle. At this point, the alarm bells aren't just ringing, they're blaring. And when the blood work comes back, wow. It tells a really alarming story. His creatinine levels are up, which points straight to his kidneys being in trouble, and his liver enzymes, you've got bilirubin, ALT, AST, they're all way, way higher than they should be. So this wasn't just one system failing anymore. No, this was a cascade. His entire body was tipping into a multi-organ crisis. So the medical team does what you'd expect. They hit him with powerful, broad-spectrum antibiotics. But it wasn't working. His fever wouldn't break, and his breathing just kept getting worse as fluid started filling his lungs. By that evening, he was in the ICU, on a ventilator. The mystery was only getting deeper, and everyone knew time was running out. So now, the doctors are in a full-blown race against the clock. Their standard treatments are failing. They've got a patient whose organs are shutting down, and they have no idea why. They had to connect the dots, and they had to do it fast. And this brings us to the central question, the real mystery here. How could a simple skin abscess, one that looked like it was totally healed, lead to a catastrophic body-wide shutdown? It was becoming clear that the local infection wasn't the problem anymore. Something else was going on. Well, the answer lies with a truly terrifying weapon in the bacterial arsenal, something called a superantigen. Okay, think of your immune system like a highly trained, well-organized army. A normal infection, it activates maybe a small, specific squad of soldiers to go fight it off. Very targeted. But a superantigen, it's like a master key. It doesn't just activate one squad. It bypasses all the normal controls and activates up to 20% of your immune cells all at once. The result is a massive, chaotic, and completely self-destructive friendly fire incident, what we call a cytokine storm. Now, one of the terrible downstream effects of these toxins is a process called hemolysis. And that's just a fancy word for the rapid destruction of your red blood cells. Imagine those cells just bursting. When they pop, they release all this stuff, including bilirubin, into the bloodstream, and it just overwhelms the liver. So you see, the patient's liver wasn't failing because it was infected. Nope, it was failing because it was literally being poisoned by the wreckage of this massive red blood cell destruction. And this brings us to the microscopic smoking gun, the key piece of evidence. When the lab techs looked at the patient's blood under a microscope, they found them, ghost cells. These are exactly what they sound like, pale, empty husks of red blood cells, the clear victims of that toxic destruction we were just talking about. This was it. This was the irrefutable proof of what was happening inside the patient's veins. Okay, so with this evidence in hand, the team could finally put a name to the killer. Toxic shock syndrome, or TSS.
But this diagnosis came with a huge puzzle, because this patient, he just didn't fit the classic profile. See, the official CDC definition for TSS requires a few specific things. You need a high fever, a widespread rash, and involvement of at least 3 organ systems. Our patient checked all those boxes. But there's one more big one: hypotension. That means critically low blood pressure. It's literally the shock in toxic shock syndrome. And our patient? He never developed it. His blood pressure was stable. And that is what made this case so incredibly difficult. I mean, the case report itself says it perfectly. An atypical presentation without that classic symptom of shock can make this diagnosis a real challenge. And think about it, by the time the shock does develop, it's often way too late. And this, right here, was the crucial insight, the game-changing lesson from this case. The medical team realized that the toxins, they can cause absolutely devastating organ failure before the patient's blood pressure even begins to drop. So waiting for shock to confirm the diagnosis? That's waiting too long. You've already lost critical time. So now they've got it. Armed with the right diagnosis, the team could finally stop guessing and launch a targeted counterattack. And this is where our story takes a turn, from near tragedy to a really remarkable recovery. Their strategy was a brilliant 2-pronged attack. First, they kept up the powerful antibiotics to kill off any lingering bacteria. That makes sense. But second, and this was the critical move, they added a specific antibiotic called clindamycin. And clindamycin has this amazing, unique property. It basically goes into the bacteria and shuts down their ability to produce those toxins, the super antigens that were causing all the chaos. So it doesn't just kill the soldiers, it literally shuts down the weapons factory. It stops the problem at the source. And the result? It was nothing short of dramatic. Just look at this. On the left, that's his lungs filled with fluid when he first got to the ICU. A total mess. And on the right, that's just 7 days later. His lungs are completely clear. With that toxin factory shut down for good, his body could finally heal. He was off the ventilator on day 4 and walked out of the hospital fully recovered on day 7. Just incredible. So in the end, this case is so much more than just a fascinating medical puzzle, right? It's a critical lesson, one that really redefines how we need to think about this deadly disease. And it leaves all of us with a really urgent question for the future of medicine. If we now know that these toxins can cause catastrophic damage silently before any of the classic alarms go off, then how can we spot these silent killers sooner? What new tools, what new ways of thinking do we need to develop to unmask these killers before they even have a chance to strike?